I'll be teaching you about Gription cups and augments, which are usually used in complex scenarios and revisions. And all complex cases like a post-acetabulum fracture or a dysplastic hip and revisions where there is a lot of bone loss, you can use augments, especially, and also in severe cases of pelvic discontinuity where you might need to use augments and use revision cups. So augments are a very good friend of a revision arthroplasty surgeon because you don't have any bone there to reconstruct. So the only way you can build the defects is using augments. There are different sizes available. They are made of Gription, which is highly porous coated. The material is something similar to what you see on the coating on the Gription highly porous coated cups, and they integrate very well. They are basically fillers, and they also integrate with the outer bone, which whatever is available. So as we all know, we will not talk about the basic primary acetabulum reaming. We need 3-point contact fixation for any cup to be stable. You need to have an anterior and a posterior capture, the AP capture, and a superior strut for the support. So the posterior superior defect is the commonest defect which we encounter during a revision or a complex primary. That is where you will commonly be using these augments. The figure of 7 graft, what has been told, autografts and allografts can be used in primary because there you have access to the femoral head as well. But in a revision, you will not have any bone available, so you will have to use augments. There is no way out. So that is what we are going to demonstrate here. The augments, they come in basically 4 sizes: 10, 15, 20 and 30 thickness. That is the thickness available. 30 is not available in India. You have the basic 10, the 15 and the 20, and usually the 15 to 20 would suffice for the common defects. Maybe in a pelvic discontinuity, you might have to use 2 augments. You might have to stack them also sometimes, and you might have to use an augment medially also to bridge the defect in a pelvic discontinuity. So augments are basically used in 2 ways. One is, you should understand that if you are able to get a good cup capture in the anterior posterior, that means your cup is stable. Then you can actually fix the cup, the trial, and then prepare the augment. That is one way. And then ultimately you fix the augment and put in your cup. So that is one way. There is another way where you will probably not be able to get an anterior posterior capture of the cup. So if you don't get that capture, that means your cup is not stable. So what you have to do is you have to temporarily fix the augment, means the place for the augment has to be prepared and the augment has to be fixed with provisional K wires, maybe just one, and then you actually do a trial with your acetabular reamer, the trial cup, and then see where the acetabular augment is actually being placed. And if you get good stability, because now you have 3 points of fixation, the anterior, posterior and the third point, which is the augment, which is building up the bone posterior superiorly. Once you have that, you will be able to get a good purchase for the cup. So both techniques can be demonstrated. The difference only is that in one place you have the cup which is stable, and the other place you have to create a stability for the cup by putting the augment. So the augment acts as the third point of fixation, where you will do the augment fixation first before putting in a cup. So you have reamer. So this is a normal acetabulum. We'll try and create a posterior superior defect here. ये उल्टा लगाया हुआ तुमने, इसे कैसे करेंगे? कि मैं उल्टा पड़ेगा हाथ यार. So the commonest defect will be in the posterior superior quadrant of the acetabulum, which you can see, and you can give a smaller size. This is bigger. So I'm just trying to create the defect so that you know where, So you can see here, that is the defect which has been created. It is a very common scenario in a revision or a complex primary. So this is actually going to be a problem because your cup is not going to be stable and it will fail in posterior superior direction if you don't stabilize. Just wait. Can you give me a trial? So before you go inside, you need to define your anatomy. You should know where is the anterior. Just palpate and see where is the anterior wall, where is the posterior wall, the inferior tal, and you do the reaming primarily in a way where you just start reaming from the inferior side and then gradually don't start reaming onto the superior side. So if it's a small defect, you might try and use a jumbo cup and you might get away without using an augment. But in a revision, that is usually not the scenario and the wall is deficient to a bigger extent, and you can see here that this is probably the acetabulum or little bigger than this, and this will be the posterior superior defect that you will encounter. So what we need to do is we need to build up and see whether we can get an AP capture of the cup here on the reaming. So you can give me this size of reamer. What is this size? 46. So I am starting the reaming with 46. Ideally, you usually start with the smallest reamer and you remove the medial osteophytes, you do vertical reaming, and then probably you will gradually expand the size and we start reaming it gradually. This is one of bigger size. So gradually you start expanding that till you get an AP capture, keep increasing sizes. So it has to be progressive. Don't rush into sizes. Don't go from directly like you started from 40 and then rush into 48 and 50. It has to be gradually, the socket has to be deepened as well as expanded. Make sure you are in the correct anteversion and the inclination right from the first reamer. That is very important. If you can't be changing your reamers, you can't be changing the directions, they will ream in eccentric way and you will not get that good purchase of the acetabulum. It's not working. Table into here. Give another size. So still it is not reaming the anterior posterior wall. That means the size has to be a little bigger. Give me the cup. This is 50. Something to clean this. So here you can see I am getting good purchase of the anterior and the posterior columns. That is most important. So this anterior and posterior purchase is the most important aspect of a cup purchase. Once you get that, you try and do your trial, and if you are hammer, please. So usually in a sawbone you might have a recoil, but if it's a just to demonstrate. So here you can see that I am not able to get the purchase, maybe due to the. So usually in a sawbone it is difficult to get the purchase because the bony recoil is not there. You can understand. So still we have defect. So what we will do is someone will probably hold this trial. So all the preparation has to be done on the trial and not on the original cup. That is very important because the finishing rasp has to be used to create this point. You have to come here. So this is the defect which we need to fill up with the augment here. If you have bone graft in a primary, you can use that also. Otherwise, you will have to prepare this defect. This is the smallest size. So there are different thicknesses, as I told you, 10, 15, 20 and 30, and they correspond to the different sizes. Like for 50, 52 you have 10, then you have bigger sizes which go with 2 or 3 sizes usually. And then we prepare this. This is called the finishing rasp. एक और छोटा है इसमें. So you can see it is sitting right superiorly and it is flush. Can you appreciate that? that the rasp on the trial is actually sitting well, and then you prepare for the seating of the augment here. So once you have done that, it will prepare for the seating, and that whatever extra bone is there, it will actually remove that so that the augment seats well. So that is how it is done. And once you have done that, the augment should be flush with the floor of the defect. So that is very important. Seated. So you see, it should get stability. Once it gets primary stability there, that means you have actually prepared the right size, and now it would be sitting on the floor. Now there are two ways to go about it. Since we could not get a AP capture here, you see, so that cup is not stable. Here probably the augment can be used first. So the augment can be used first, it will act as the third point of fixation and give you stability for the cup. So this is the trial which you can put here inside and check whether it is sitting well, and someone, either your assistant can hold it with these clamps, or you can hold it with the hand also, and it goes inside. This is the smallest size. Yes. So it is just like preparing a cone or a sleeve, You have to prepare the bone, make it raw so that the augment fits in there in the defect. So if this is not able to fit, then you can just, prepare it further with this rasp. Stiff. So that this is how your augment has to be there, and you can put in a K wire, please. Give him a K wire. You have a K wire? You don't have a wire. So usually what I do is I put in a K wire from here and hold it temporarily so that it is stabilized temporarily, and then the trial cup is there. Once it is there, you hold it with K wires, or you can just use your screw. Screws are not there. Pins de do. So there is a headed pin also which is available for temporarily stabilizing it before you put in the screws. And there are locking screws and non-locking screws which go through these augments. The locking screws are 5.5 mm and the non-locking screws are 5 mm. इसको पकड़ो, इसको पकड़ो. Not sitting on there. पकड़ने के लिए. हिल गया थोड़ा पोजीशन इसका ना, ये कप नहीं बैठने देगा ये. थोड़ा सा छोटा कर दो. So this is how it is temporarily stabilized, and then you can use these screws here. It's coming out. So this is how you get a 3-point purchase. You understand? So this augment acts as a third purchase. So 3-point fixation is achieved using the augment, and then you can put in screws into the cup here. You can put in screws through the cup through the slots in the augment. You can show me the augment. Trial में उसमें है वो green वाले में दिख रहा देखो. So usually you have slots like this in the augments from which you can put screws through the cup and through these into the bone. So that gives you unitization of the augment with the cup. So that is important. You can use screws here for fixation, and 2 or 3 screws are usually put, and you can use it with the primary grip Pinnacle also. You can use it with multi-hole Gription also, and also with the revision cup which has peripheral locking screws also. So all those things you can use depending upon the need of the case, and accordingly it can be stabilized. And once it is done, you can just, finally, this is the trialing you've done and you put in the augment. Once you put in the final cup, you have to unitize it with the augment. So you can use cement in between so that there is no micro motion and does not lead to any kind of, metallosis. So that is very important, that cement between the cup and the augment has to be used. So if this is your augment and it's getting in touch with the cup, this is where you will fill in the cement. You can, if you have put in the augment first, you can use the cement and then hammer in your cup and stabilize it with screws. Otherwise, if you don't want to do that, you can use the augment, use the cup, put it there and just inject the cement later on also, so that it fills the crevices in between the augment and the cup. So that is important. It prevents micro motion and failure of the whole construct, as well as reduces the micro motion. So this, you can see that the cup is being stabilized and the 3-point fixation has been achieved in the correct version and inclination. Augment sizes can be increased. If you have a defect in the anterior superior area also, you can use another augment like this, which it can be shown here, it can be used here. If you have a defect medially also, there can be an augment which can be used inside. You have an augment on augment technique also available, which is used for pelvic discontinuities. And it is usually recommended that augments are used as just fillers in revision cases, and for all primaries usually we recommend using your own bone graft which are available. So any questions if you have, we are ready to take this. See, it is little tricky because you have to place, if you are using a multi-hole cup, it is little convenient. If you are using a primary, it is difficult to place those screws in that direction. And you might not be able to achieve full compression also. Moreover, it is recommended not to put long screws so that they go into the bone behind the augment through the cup. So you are just unitizing the cup with the augment and not the cup, augment and the bone. Because if you do that, it sometimes distracts the whole apparatus. So if you are not in the right direction, you have seen that the plate can pull out of the bone. So the similar thing can happen here. Don't let that happen. So screws should not be long. Those screws should not be long.